Hello, ladies and gentlemen, and welcome to another video at the Pharmacist Academy. Woo! What if I told you that one of the main reasons why I got chosen for PGY1 residency is because of my presentation? And not just my presentation, technique, but also the topic itself. And I'm saying this because that's exactly what the program director told me 1 year after completing my PGY1 residency. As a PGY1 and a PGY2, I got the opportunity to sit at interview presentations. And I must say, what I normally see is presentations on clinical topics. But in this video, I'll give you 10 unique pharmacy residency presentation topics that will help you stand out. And these are topics that are definitely going to grab the attention of the program director or anybody that's going to be at that presentation. The first one is something about USB 800, specifically how to be in compliance with it. This is one of the hottest things out currently in the pharmacy world, and this is something that organizations such as Joint Commission or even CMS will survey hospitals based on. Preparing for Joint Commission, another unique topic, but really important. I mean, program directors, this is what they care about. Doing well during Joint Commission surveys or even CMS surveys. Believe it or not, in the hospital, the patient is our number one priority, but what comes right after that is just being in compliance with the standards that are recommended by the different federal organizations that actually give the hospital money, right? They help the hospital gain more money. So this is something that we all care about at the end of the day because this could definitely impact everybody, right? Especially employment, for example. So this is a great topic. Trust me, you cannot go wrong with this topic here. Next. Antimicrobial stewardship. This is still hot, okay? It's not going nowhere. It's very important. A lot of institutions just started theirs, so they're finding ways to improve in that. So you could do a presentation that talks about the qualities of a strong antimicrobial stewardship program. Anticoagulation stewardship. This one is fairly new. I believe it's already recommended by the Joint Commission, and that's something they survey hospitals on. So look into this, really. I mean, I don't know too much about it, but I'm assuming it's very similar to the antimicrobial stewardship. I mean, I would love to be at a presentation about this topic here. Next, 340B drug pricing program. Another big one. Once again, this program here is helping the hospital save more money. This is a big deal for pharmacy directors. And trust me, if you are able to impress the pharmacy director, you will be good to go. Next, medication safety. That's always a good topic. This is something that all hospitals make sure they're doing great in, especially in oncology, right? Oncology medication safety, that's very important because that's a high risk place. So if you could include in your presentation how technology can be used to improve medication safety in a hospital setting, it's definitely going to catch people's attention. Handling medical marijuana at your institution. So this is something that's, becoming very popular. A lot of states are legalizing marijuana for medicinal uses and even some states for recreational uses. So sometimes you may get a patient who's actually on medical marijuana and they get admitted to the hospital. What if that's one of the medications they bring with them, Like how is that institution going to handle it? The role of the informatics pharmacist. Now, just to throw it out there, I did my presentation on the role of the transitional care pharmacist. And the informatics pharmacist, they play a huge role in the hospital. And I feel like we may not fully understand exactly what they do or what they're capable of doing. So, doing a research on this and presenting it will be definitely helpful. Oral oncology drug interactions. So, that is where oncology is heading, ladies and gentlemen, where the patients can actually take these medications by mouth at home, right, in the comfort of their own home. This helps improve their quality of life also because they don't have to go to the hospital to get chemo infusions or go to the clinic neither. Unfortunately, for these oral oncology medications, they have a lot of drug interactions. So you may get patients who are admitted and at home they were taking one of these medications, for example, you must be able to recognize some of these and take the proper precautions. So doing a presentation on this, I mean, it is clinical, kind of clinical related, but it's different, okay? It's just different. One of the hottest topics in oncology, I would say 2018, 2019, and it's still hot just because it's a pretty cool concept. So always when you talk about it, people are definitely going to be into it just because of the way it's designed and how it works. It's really interesting. So that'll be the end of this video. I gave you the top 10 most unique presentation topics. I'm sorry that I didn't put this video out earlier because I know a lot of you guys have probably been to your interviews, but I hope there's still a decent amount of you guys that get to see this video before you even start preparing your presentation for the interview. If this video is helpful, make sure to like, comment, subscribe, and share the video with anybody that could benefit from it. Connect with me on these social media platforms. Take care.